Studies have shown that premature infants, now again, you're not going to be working on infants per se, but you will see the effects many, many years later. And we want to talk about that. If someone says they show a certain type of anomaly and they say, and you get some information, they say, well, I was premature, or you can ask them also. They have an increased risk for developing, again, problems such as delayed tooth eruption, we'll talk about that in just a moment, enamel hypoplasia, and that's one we want to talk about extensively. And I have a journal article that's associated with that, again, low birth weight babies, premature babies, and then enamel hypoplasia. Also tooth discoloration and something called a palatal groove, which again is kind of post birth, and we'll talk about that. Delayed tooth eruption, first of all, is very, very common among premature infants. Consequently, primary tooth eruption may be 2 to 6 months late. We'll also see systemic consequences of prematurity, but this again for us is 2 to 6 months late. Now remember, we have about a 2 to 6 month time period, again, for someone being, again, precocious, early, or slightly delayed, or slower to do it. Again, that would be maybe 2 to 6 months, as you can see by the chart. Studies have shown these delays are caused from infection, again, after birth, poor nutrition, and prolonged intubation. Some researchers believe that actually the birth process kind of stimulates the process of tooth eruption. Therefore, a premature birth, again, that occurs before the normal, again, process of tooth eruption can alter this process. Again, premature infants have enamel hypoplasia. That'd be the second thing that can occur 4 times more than often than term children. Ones that, again, they go the 9 months. That'd be term children. Again, 2 weeks either way is not really considered prematurity. Again, look at the article that I've attached. Now, primary maxillary left anterior teeth are twice as likely to have enamel hypoplasia than those on the right. It can also be found on permanent teeth. However, the problems are generally less severe in the permanent teeth. Now, this specific location for the damage cause is by intubation. You know, in the little intensive care, or that'd be neonatal intensive care unit, or NICU. So they might say, I spent time in my NICU. Again, that's a neonatal intensive care unit. And mechanical ventilation, as well as lack of certain nutrients, because they can only put so much into the child, so much. Again, it's not exactly the best nutrition, again, that the mother provides by way of the placenta. Children with enamel hypoplasia, again, are more likely to develop dental caries, and that's in the case of the prematurity. That is not always the case, again, with other reasons for enamel hypoplasia. This developmental, again, disorder then brings on this enamel hypoplasia, again, dental caries in infancy to young childhood. And these are called early childhood caries, or ECC. Since the developmental disorder provides an ideal retentive surfaces for early, again, dental biofilm colonization, these affected children will need thorough routine home care and close monitoring by their dental professionals all the rest of their lives. Now, true as dental hygienists, we may not see them, again, in their infancy or even their young childhood, and again, their young teens. That sometimes is seen, again, by the dental assistant and the dentist. But you remember I was talking about on one of our things, so you can have some times that you gather this information and then share it with your dental team. Don't do it as a Mr. Know-It-All or Mrs. Know-It-All. No. We share these things because this is our education. When we share them, again, it does take a village, again, to have a dental office. We're a part of the team. Never forget that. The third thing is tooth discoloration. Generally occurs only in those preemies, and the name given again to premature infants is called preemies that have the high bilirubin levels seen in an NICU. Remember, the high bilirubin levels are present because the liver is immature and cannot break down the red blood cells. They undergo this light. They have to wear little the masks and things like that. And now they have at-home light breakdown things, so break down the hemoglobin so that your infant does not even need to spend time in the NICU unless they're have other things that the preemies have. It appears as an intrinsic, remember, within the tooth system of yellow or brown color and is only seen on the primary teeth. The next thing I want to talk about is the palatal groove. This is a narrow groove on the hard palate. This is caused by the orotracheal intubation in the NICU. Some preemies have developed grooves after being on the orotracheal intubation as few as 7 days. But generally speaking, the longer the intubation time period, the more likely the palatal groove will develop. Complications such as crowding or poor positioning of the teeth, sucking or speech problems, sucking is very important, again, for the bottle, as the breast as well as the bottle. And also remember, that's again early ways of our muscles, of our oral cavity getting mature as they're being used. Also, there could be speech problems and or hearing problems may result, again, from the palatal groove. Whether premature infants need orthodontic therapy more than general population is a subject of controversy. Some orthodontists treat preemies' crowded teeth or a palatal groove with a spacer for the first few years of life. Newer devices are being used, such as an acrylic palatal stabilizing device, or PSD. So there's a lowdown on, again, premature infants and their developmental, again, problems or, again, anomalies. Please look at the article attached on enamel hypoplasia, and again, take it easy. I hope everybody's enjoyed this couple minutes here of additional information, again, on dental abnormalities or anomalies. Take it easy and enjoy. Bye-bye.